There you go.
Okay, we'll try this. I heard myself. Okay. So hopefully it is working. Do you get any thumbs up? They can hear me yet?
Yeah, they can hear.
Okay.
Yes,
So welcome.
yes.
I guess you didn't hear last time, so this won't be a repeat. This is our second forum that we've done with staff. I felt positive that we were able to do this prior to the required meeting for teachers and staff of the district. It allowed us to work together with the ATA to go through some common concerns that we had. There's no playbook for this. There's no text we can go to say, how do you open school during the COVID-19 outbreak? So we have to work together, be flexible, find solutions that meet the needs of staff and students and our community. And we have representatives here from Montgomery County Department of Health, from our district office and special education. So we have a lot, and then our principals are online too. So we can take questions as we go through. We shortened the slides a little bit from the original. We have a special education focus on this one. In addition, there's some opportunities for to see about daycare for our staff, because we know that's been a concern, and some other items we've added. So we'll get into the presentation. This is an updated plan. We're constantly getting guidelines and updates from the CDC, from Montgomery County Public Health, from the state of New York, from the Department of Health. So it's been changing. I think it will continue to change through September and October as we go through this process. We resubmitted this plan to the state last Friday with some of the updates. We have the required components prominently displayed on the top of the webpage to meet those requirements. Aside from that is that we did submit our opening plan to the state on July 30th. So you may have seen me on the news saying that we did. So as backing up our school, we did go through the process. We are clear to open, and we've done all the required components of that. As I said in all the parent forums, we will open when we determine it's safe to open all schools. So we've said this from the beginning, that it's flexible, that it's meant to be something that can adjust if need be. We have capital project going on in multiple buildings. We have Lynch Middle School has a lot to have done. Air handler systems are on order that are coming into the Port of New Jersey next week, and hopefully will be here in time. So all these pieces of the puzzle without COVID would have an effect on school opening. So I've said this to parents from the beginning. We have a schedule that pushes out until September 21st with kids, and I'll get into that in a second. But from the beginning, we've said when we're ready, we will open in the safest manner possible. I had a nice conversation with Chris Deffabaugh, who's the new director of the YMCA in Johnstown. So the Y in Johnstown and the Capital District YMCA have capacity for additional kids in their daycare program. So I put up the contact information for the YMCA in Johnstown, and then Nancy and Christine just added Rachel Bonaquesti for the contact at the Capital District Y. So they both have space. I know childcare is a huge issue. It's not unique to teachers. It's everyone looking for childcare. It's a tough one for people that want to go back to work. So hopefully that will assist in that. We understand the concerns with that. So hopefully this will be helpful. So the remote only option was something that when we put surveys out for parents, we had feedback that 30% didn't plan on sending their kids. And that was, Jen, when did we start that? It was probably 4 weeks, 3 weeks ago.
6 probably.
Was it 6 weeks ago it started? Okay, so it started right when I started it, and the feedback was about 30%. Since then, we have over 1,500 kids. So we're nearing 50% of our kids who parents have said they want them to do the remote only learning option. So we've said that tomorrow's the last day for this. The original deadline was last Friday. There's such an outpouring of demand for it that I've asked the principals to talk about what that will look like for them. What the remote only option will be for the kids. Mr. O'Mealy talked about it today during the parent forum to say what it would be as far as the scheduled classes. So each building might look a little bit different, but 6 through 12 will look the same, that they have scheduled times that they meet with their teachers, with all of you throughout the day. And a teacher might have 3 sections of in-class students and then 2 sections of remote only, depending on your schedule in particular. You won't have kids in your class and remote learning. That is not something we're doing. So it's one or the other at the same time. So we'll continue to keep that updated until tomorrow when we get our last respondents. They have to commit to this for 10 weeks. And obviously there was a need for it. The parents were demanding this and just don't feel comfortable quite yet sending their kids. I've been pleased with working with the ATA since I started here. We've had really good meetings, positive meetings that, we've met several times throughout this. The initial schedule that we put out was altered because of the feedback from you that we wanted fewer kids to start. So we went down to 25% in the elementary. I had opening day starting around September 11th and 12th, and we pushed that off and allowed for some orientation for all of you to get back into the building and get used to the process. And you'll see this in a second, that students aren't going to be back in the building for that purple and gold rotation until September 21st. So this has been a nice process. The ATA and myself realize we have to work through this together. We can't be at odds with it, so we'll continue to work with you, listen to your feedback and concerns, and address as much as we can in an area of uncertainty for all of us. So a couple things that came up in our conversation we just had with the ATA, and it was the BCS, which is the Building Condition Survey. That's a 5-year-old survey, and what that is they go through each building. We pay an architect to go through and do that, and then the next building project is based on things that are found in the Building Condition Survey. The visual inspection is a little less informal and happens every 2 to 3 years. The Building Condition Survey is every 5 years. So the project that's going on now is a result of the Building Condition Survey from 2015. So I forwarded that to Gino and Rich to take a look at that. But what you'll find is a lot of the things that were brought up have been addressed in that. So just to let you know that. We have a contract to have our air handlers tested for the new MERV 13 filters that are on order. We have to make sure that the air handling systems can handle that filter because it reduces the flow, because it's more to the filter. It's substantially more. So that's going to be done in the next few weeks. But again, there's so many pieces of this that nobody could have taken into consideration before. So we're having the test done to make sure that those filters will work. The water fountains, I'm told, in 5 of 6 buildings, we have the filter water bottle stations. And this is, a concern. I wanted Sarah's opinion on this too, because initially, I know if you go to Dunkin' Donuts, they're not refilling refillable cups. So we didn't want kids using their water bottles and refilling because you're putting them near there. Have you seen those? They're activated by a sensor. So if we have Dixie cups, is that okay at those filling stations?
Yeah, anything that's disposable is much better than anything that's refillable. So if you're going to put, a coffee cup under a Keurig machine that's not been washed, that's not okay either. So
Right.
With the water filling stations, it's really making sure you have disposable
cups. Okay. And then the actual water fountains, the old style, we're going to cover those, right? The kids are not going to use those. They'll be inoperable.
Yes.
Okay. So, but we'll work on the other school that doesn't have those because we thought that was obviously important. If not, we'll bring water in, but it's just such a process to bring water in single bottles or in 5-gallon distribution pieces. So BCA is our architectural firm, and we had them come in. Mike Greco coordinated with Stosh putting this together, that they did an air transfer test. And the air transfer test, and this is something we talked about with ATA yesterday, this analysis said that at full capacity with all of our kids in, we meet the SED requirements for air transfer. So this isn't air quality, this is different. This is how much air is pushed through the system that meets minimum standards. So we meet that, which is a positive thing. It doesn't change the filter part of it, but at least we know that when we're coming in with kids that, remember our schedules that were 50% of kids based on the purple and gold, 25% at the elementary level. It means that we have half the kids, and now almost half of those kids that we were talking about are going to be remote learning. So we're down to like a quarter number of the kids that we thought we would have. So that's a small number. So our capacity and our air requirements really should be fine. Fans, we were looking for guidance. It's gone back and forth on this. Fans should not be blowing onto kids or have a kid that could possibly be ill and then blowing out onto other students. So Sarah, we've emailed you about this. You want fans that only exhaust air, blow out through a window.
Out through a window.
Yeah. So an oscillating fan in the classroom we don't want. We want a box fan that pushes air out the window.
Yes.
Okay. So, and windows being open, we can have windows open.
Absolutely.
There's a security concern of that on the first levels of buildings, but that's something we have to take into consideration and talk about. But for other places, it's you can put them on the outgoing and a window, just push air out. In bathroom fans, I was assured yesterday that all of our bathroom fans have operable fans blowing air out externally. So that was a good one to know, to make sure, because that's been a concern. It doesn't answer all the questions about seat covers and things like that. We're looking into that, but seat covers, we're getting pricing on them because we only have seats right now, and there was some guidance on trying to get covers because of the particles. Do you want to talk about that at all? Is there urinals versus you want to get?
There's really no good answer with bathrooms. I mean, nothing in a bathroom is 100%. Other than after somebody uses the bathroom, going in and spreading and spraying it down. I've said from the beginning, 75% of the time, if we get it right, we're doing great.
Good.
So
Okay.
Bathrooms are one of those things. We're going to have to use the bathroom. We know bathrooms, no matter what, are gross and dirty, and we just have to take it for what it is.
Good.
Seat covers, are they the best? Some people would say yes. Other people would say, well, it's gross because now you're taking that seat cover off. And then what do you do? What if the kid doesn't wash their hands?
Right.
What if a kid doesn't wash their hands even with a seat cover?
Right. Touching the seat cover. Yeah.
Right. There's a lot of things.
There's no foolproof.
There's no
components of it.
foolproof.
Okay.
No.
So we're looking into seats at least for the adult bathrooms, because the concern was kids will probably tear some apart or won't
Sure.
use them and things. So
Absolutely.
we'll do this as a process and implement it over time. So to get into the remote only option in the elementary in the morning, the students are expected to have contact with all of you to start their day. That's why you're starting without kids until later in the day, until 9:30. Wednesday is the full remote for students that are out of the building. The purple and gold will follow the same schedule. And then for 6 through 12, that 9-period day will also follow that remote only throughout the day. So there'll still be a 9-period day. You'll still have kids that have math class at 8:30, if it's Monday or Thursday or Friday or Wednesday. So I think that our secondary did a great job with that schedule that allows for that consistency. So I know my own kids, getting up late in the day, my son would wake up at 11, my daughter would be up at 7:30 ready to work. So this gets those kids on the computer ready to go for class, which I think is important to have that structure. So I was happy to see that. It also allows us to transfer from fully remote to full in-person. So if, everything, the stars align and we're able to have kids in fully in the day, the schedule works that they're there every period and it's ready to go. So it doesn't need to be a change. Updates to special education. Christine, do you want to take this? You want to just run with it? Okay.
So the biggest change to special education is we were scheduled to have special class students Monday through Friday in person. We've changed that to Monday, Tuesday, Thursday, Friday. Wednesday, students will participate just like their peers in remote learning with their teacher. We already talked about the hours for elementary, and the big shift obviously is Wednesday will be a day that is dedicated to related services. So we will offer related services in person. We'll offer them at one building. I think Techler is the school that we're looking at. So those students who struggle to have therapy remotely, right now we're looking at OT and PT primarily, getting that service for those students because we know that service is so much more meaningful and beneficial in person. So just something we're looking at. Why the change? Obviously, we know based on the enrollment for remote learning that so many people are signing up for that. We also know based on our special class survey early in July, 50% were not comfortable sending their children. So we knew that that was a possibility. Certainly, we want all students engaged as much as possible. So we shifted Wednesday from instruction to certainly related services, just thinking that that would be another way to really target the needs of our students. So all students we know are required to wear a mask in school and on the bus. There will be, however, a handful of students who are unable to wear a mask due to a medical condition. First, if that child says, or if that parent says they're unable to wear a mask, the first thing to do is speak. That parent should be speaking to that child's physician. That's the first directive that we've given to parents. Have that conversation with the child's physician. If after that conversation, the parent and the doctor feel that they can't wear the mask, then they need to provide the school, myself, Tim, Stacy, building principals, medical documentation of what is going on. From a CSE perspective, we'll add that accommodation within their IEP. For students on the gen ed side, that would mean a 504 plan. Again, it may not be an all or nothing thing and that a student doesn't wear a mask. For some students, that may be the case. For other students, it may be they need increased breaks. There are limited times that they can wear it. So it's really looking at it holistically and seeing what's going to make sense for that student who has that specific need. One-to-one aids. So we know a number of our students have one-to-one aids. It won't be possible to practice social distancing. So we'll ensure that those students and those staff have the appropriate PPE to remain safe, both for the student and the staff. Related services, we talked about that. Obviously, to the greatest extent possible, we are going to provide all those services that are listed on a student's IEP. We've talked about how it makes sense to push into those academic classes. You know, the time in school is going to be so limited, so we want to make sure that we reduce pulling out students as much as possible so they're not missing academic classes. Again, those therapies are going to be provided both in person and remote. You're going to need to adapt some of things that we've previously done. We're all going to have to be a little flexible, a lot flexible, and certainly work with parents because we have parents who are working, a lot of different challenges. CSE meetings. Anybody who has participated in CSE meetings knows that they've certainly since March have been going through Google Meet. And just like we're doing today. So that will continue moving forward. We've seen a much more positive response from parents and engagement, which has been great. So certainly we've asked parents to update us with emails, with phone numbers. So, as case managers or as teachers, if you receive updated information, if you can share that, that would be helpful. Just, keep those open lines of communication. Reevals and evaluations, again, our timeline has not changed. So those will continue. They'll continue in person. We've had some going on this summer. Obviously, we know that in person makes the most sense, is most beneficial to that student. So again, when those evaluations are taking place, whatever PPE is required or is needed, we'll ensure that the student and the staff have those. And again, as we've been saying, we know that communication and collaboration will, need to continue and take place between teachers, providers, parents. So all of that will certainly continue We need to act certainly in the best interest of our staff and our students to ensure that all the accommodations and modifications that are on a student's IEP are going to take place. Changes to IEPs. So for those in our special ed world or who have dealt with our special education students, we know that amendments. Amendments are any change to an IEP that take place outside of a meeting. So we'll use the mask for an example. If a student has a medical condition and has a note from a doctor indicating such that we need to amend that IEP to reflect that change, to reflect their inability to wear a mask or limited times. We can do that through an amendment, but that change doesn't take place until that parent signs off on that amendment. So just because the note is provided does not mean that that change is taking place. Sometimes, as you know, that can take a while. That's going to be the same thing with the 504. So simply providing the note doesn't complete the process, just so everybody is aware of that. For the IEP, we need a parent signature. And again, then we process that. And I think most people know the drill after that. And now you're back up.
Thank you. All right, and
There was,
a couple questions or no?
well, there are a couple, but I think you answered them within it. So one was about special ed parents being notified that the kids need to wear masks.
Yep.
But then there's kids who, with medical reasons,
Yep.
can't wear masks.
Yes. You want me to address it again?
Well, you talked about that with, it's an OHI or, it's
Yep.
it's a 504, it's not special.
Yeah,
ed,
so not everybody who has an inability to wear a mask is going to be a special education student. We have students with a variety of medical disabilities or medical diagnosis, I can't think of what I'm looking for, but that are going to be challenged in wearing a mask, whatever that may be. So each situation will be unique and will have to uniquely be addressed. Some will be addressed through CSE, some will be addressed through the building level.
Sorry, for the 504s,
Yep.
yes.
So then
Considered
that
other
takes
health
us
impaired. Yeah.
to 1511 kids. Will they be here more often? And they're the ones who might have to that push out for ICOT or CT.
So again, special class will be here Monday, Tuesday, Thursday, Friday.
Right.
4 days a week. Whether you're 15-1-1, whether you're 12-1-3 plus 1, whether you're 12-1-2. 4 days a week, Monday, Tuesday, Thursday, Friday.
And I'm really not sure if this is your question or your question, but
It's a Sarah.
actually, so if you have a kid in your classroom, whether it's special ed or gen ed, and they have a medical excuse for not wearing a mask, will N95 masks be provided for the teacher and the other students in that classroom?
Wait, for students, if we
Sarah,
can,
can you
I don't
answer
know.
that?
Sarah, you want to answer if they need them then, or?
I mean, an N95 is always the
Best.
gold standard of
Right.
a mask, whether you're working with special ed students or we're just sitting here in this room. The problem with N95s is your teachers are going to need to be fit tested for them because the N95 that Jessica is wearing right now is specifically fitted to her face. So you can't just go to Home Depot and buy N95s and get the same efficacy as if you were fit tested and had the appropriate N95 for your face.
So my package of N95s, they're not really up to.
No, because they
So-
could be too big for you. They could be too tight for you. They could be too tall for you. They're not covering appropriately.
Sarah, what is your advice for the special ed population, the aides who have to be one-on-one with those kids and there's no social distance? What is your advice? What type of masks would you advise us to purchase?
An N95 would be great, but you're going to need to get your staff fit tested. And you have 2 weeks.
Yeah.
To get all of your staff and find, your ACMED services or your employee health to do that fit testing.
Okay, so I have to look into that.
So you can
Well,
help
so we have-
Eastern
So
Medical,
here's
Sean
my-
Kulisecki.
And that's,
Eastern Medical?
Yeah.
Okay.
and then certainly we have students and, again, as Nancy said, that question with classmates or teachers, because we will have non-sped students who are unable to wear a mask.
Right.
Not
So
even
those
just our
students-
12-1-4.
Those students who might require a 504. So there most likely will be a regular education teacher in a classroom where there's a student who has a 504 that cannot wear a mask.
Correct.
So again, that teacher, you recommending that a teacher wears an N95 mask also?
Yeah, but how many teachers do you have district-wide? And if you have one kid in that class who has a 504, and that happens in every single one of your classes across the building, I mean, you're gonna need to fit test and buy thousands and thousands of N95s.
Which are hard to get.
Which are very hard to get. So your better bet might be, if that kid can't wear a mask, to sit them in a place in that room where they are far enough away from the teacher and the other students where a regular
That's a good idea.
surgical mask is more effective.
Okay, so put that child somewhere in the room where they're 12 feet apart or further than the other students. Is that what you're saying?
Yeah, or have a desk in each room for 504 kids that's got a piece of plexiglass or whatever.
Oh, plexiglass.
You know.
Plexiglass, good idea.
I mean,
Okay.
plexiglass is not great because who's the person that's gonna get
Go clean
stuck
it.
cleaning that
Right.
and then those germs? I don't like plexiglass, but I mean, you have to do something, right?
Alternative,
You
right,
can't-
it's
Yeah, you
yeah.
have to have some kind of
Right.
alternative. Again, 75% of the time, if we get it right, we're doing great.
What about KN95s or NK95s?
I mean, a KN95 is just a duckbill and they leave, again, more space up here, more space up here. They're great, but you have to have the right one.
Okay, they also need to get fit tested as well,
Yeah.
because those are easier to get and less expensive.
Yeah, they are less expensive, but like I have a KN95 and it has big, huge gaps here because it's not one that fits my face, but it's the one I throw in the car if I need an extra mask if I'm
Right.
out of something. I mean,
Okay.
they're not, a regular N95, like what Jess has on, is like the
How long
cream
did
of
that take
the
to
crop.
get fit tested?
I got way back when I was in nursing,
Oh, okay.
back and we did it. But
So you know
it
the
doesn't
size
take,
you
it
need.
takes about 20 minutes, I would
Okay.
think, for someone to be fit
And
tested.
Eastern Medical is the place, okay.
Yeah.
Okay.
It's a process.
So we have,
Some people fail for fit test too and can never be fitted.
really?
Yeah, it's
Okay.
just, so fit testing is it's going to tell you what your face fits, but there might not be an N95 that fits you.
Wow.
So it's, some people have very small faces, some people have very large faces, and N95s don't come in they're not a one size fits all, they're different sizes, but you may fail it, like Jess said, a fit test.
And perhaps students who maybe can't tolerate a mask, perhaps look into face shields for those students who can't tolerate a mask.
Yeah.
That might be an option as
We
well.
did order those too.
We ordered, so we have, then on the bottom of this, we have 1,000 face shields. We did have 10,000 masks. I think we got another 5,000 in. So we have them to give out to students on a daily basis if need be. We've, told parents they can send their kids in with them. We are going to put out, this part of ATA asked us about it, to say that the neck gaiters and the bandanas are not acceptable. We've been found that they don't really work. And so we're going to make sure parents know that those aren't acceptable.
The other thing I'm concerned about when we're talking about disposing of masks, if you have who's going to be in charge of taking out the garbage, right? Who's going to take out the garbage that has this overflowing garbage can of all of this PPE and these gloves and these masks? So, your custodial staff really should be the only people handling that garbage.
Okay.
And it should be one person per zone or per group of classes, because if that person gets sick and they were handling the garbage, we have the capacity to look back and say, it was Jessica handling the garbage for these 15 rooms.
Okay.
Excuse me, Mr. Drexel, are you monitoring the YouTube channel? Because there's been some questions, I guess.
So we're not gonna be able to answer all of them. I can monitor YouTube.
This is a question for all of everybody here, about the remote learning students. Some teachers are asking for clarification. When you said that they will follow the purple and gold schedule, what does that mean exactly? They're only online when purple kids are online and only online when gold kids are online, because we're planning online for ROL separately from online assignment, or for just purple and just gold. That's what they're wondering. It's confusing to them.
Well, that's going to be a schedule that a lot of these are building level of how they're going to have it look. So we have a couple of the sample schedules that Donna Decker sent out and that Tyrone went over today. But generally, it's going to be that they have a schedule to follow, that they'll have an 8:30 math class. And what it means is if you teach math, you could have 5 sections of math, and you would teach 3 sections of math with students in your classroom, and then 2 sections could possibly be remote only, where students are home and you're teaching them remotely from your from your classroom. So that's how that would work. And so those kids would have that scheduled time that they meet with you.
And there were people asking about that schedule, if they're, when they can see it, and Mrs.
So
Decker
it's
just
still-
texted me and says it's not
still-
quite.
So,
so-
yeah, the
Yeah.
elementary schedule is still in draft, so therefore we were not share that schedule until we reviewed it together as a team. Once we reviewed it together as a team with the building principals, we will share out the schedule to all the elementary teachers. Again, it's in draft mode right now.
And again, with remote only being 1,500 kids, it's, changing how we're doing scheduling, and it's had a dramatic effect on it. So sanitizing, we have a sanitation station at each classroom will have it. So what we envision in 6 through 12, definitely 9 through 12, is students have the ability, once they are going to sit down at their desk, to have a wipe that they can clean their own desk. They're old enough, they can do that. We didn't want to rely on the students that are leaving the classroom. We're not asking teachers to do it. It wouldn't be feasible to have custodians come in every classroom in between and clean off every desk. It couldn't happen. We'd need, 200 more custodians. So I think that's some responsibility that the students can take, that they have those to wipe down the desk. Each entrance will have a pedestal hand sanitizer, like you've seen in, malls and things where you walk in, you can use that. We're requiring that students and staff wear masks throughout the day, and we're not allowing students on the bus or in the building without a mask either. So, Sarah, do you want to talk about our partnership as far as the components of it, that if something were to occur, we work with you and we do the contact tracing through the Department of Health?
Sure. I'm actually going to let Jess talk about
Jess, okay.
contact tracing to start, and then I'm going to fill in the more, so she'll go over the step-by-step what happens when we have a positive, the clinical information,
Okay.
and then I'll talk about the policy.
Great, thank you.
Yeah, certainly.
Do you
Thank you.
understand? Thanks.
Should necessarily.
Oh,
You can-
okay.
you can be safe.
Yeah, and we can, get this to you guys in writing, everything that I'm going to talk about, so you can actually see it. So pretty much, contact tracing and when individuals test positive for COVID isn't going to change from what we at the Department of Health have been doing. It's not going to look any different logistically for if you guys get a positive within your district. So our recommendation protocol is going to be anytime you have a student or a staff member that presents with a COVID-like symptom. And as we all know, and I'm sure everybody is fully aware of, that is a very broad list
yeah.
of symptoms, right? So I caution people, and it's not as black and white as we all.
They're having a hard time hearing you. I don't know if you want to get
Yeah,
closer.
stand to the mic.
Sorry.
Yeah, that's okay.
Stand. Yeah, the mic is up
Mic's up there,
I can-
yeah.
Yeah,
Thank
sure,
you.
certainly. Is that better?
I'm waiting for a response.
Okay, so when we look at protocol and what we do for staff and students who potentially could test positive or be investigated for COVID, the procedure and policy is pretty much what we've been doing all along at the health department since COVID started back in March. We're going to ask that you look for some of the signs and symptoms for COVID in your students and certainly in staff. And we ask people to self-monitor really. If they have a fever, I don't know if you're going to have the ability to check temperatures or if you're going to require staff and students to check at home.
So we have a system for check-in for students, and we can use it for staff as well.
Okay.
So
okay.
we're going to have scanners at the door. We have scanners that can do 50 people per minute, but we also have the handhelds. So
Perfect.
we'll have
Perfect.
both.
So we're going to look for fever, cough, and shortness of breath are really top 3 tail signs of COVID. But of course, there's also some everyday symptoms that everybody may have on any day. Headache, congestion, sore throat, loss of smell or taste, nausea, vomiting, diarrhea, muscle pain, body aches. I think you really have to look, and it's going to be difficult, and I know your nurses are, very well versed in the signs and symptoms of COVID and what to look for, and they're definitely going to be a good resource. I know Sarah and I are going to be meeting with a lot of them next week to review this policy as well. But I think it's kind of everybody's responsibility to recognize some of the things that might be going on. And really, so if your students or staff themselves are experiencing any of these types of symptoms, you're going to want to isolate them and have an area designated for isolation. And within that area, it does have to be away from others in an area that can be cleaned. So we look for hard surfaces, chairs or cots that can be wiped down after, should unfortunately someone be positive for COVID, that you are isolating. We're going to have you call a parent or a student's parents or guardian, pick them up immediately and send your staff home immediately. And then what we want people to do is once they get home, we want them to call their primary care doctors for an assessment evaluation. As we know, a lot of physicians are doing telemedicine. They can assess your student and your staff member to see if it truly is something COVID. They're going to ask about travel. They're going to ask about exposure. They're going to ask about pre-existing conditions. Is this something, a kid has irritable bowel, so he has diarrhea frequently? It's nothing new or different. So we want that assessment to be done by a primary care physician, a medical doctor, to see them. And then based upon that physician's recommendation and assessment, two things are going to happen. They're going to recommend that the individual be tested for COVID, or they're going to send a note saying they're fine. They're going to test them for strep throat. They could have ear infections. They could have a regular norovirus. It's not as black and white as we all would wish it would be, because as you all know, you're educators, we're providers, we work in healthcare. There's a lot of things that are around, viruses, germs, flus, everything. So it's going to be a little tricky. But if that staff or student goes to their doctor and they say, nope, we think they're good, they can return to school, you guys want to get that in writing, and then, or if they have a negative COVID, you can allow them to return. So what happens if somebody tests positive for COVID? And this is really one of the big, I'm sure this is everybody's biggest concern. Yep. This is kind of why we're all in the predicament we are because of COVID. Whenever anybody tests positive for COVID, public health, so two different things happen. So whenever a positive test report is reviewed by the state, it goes to the residency of that individual. So that's something I think I need everybody to keep in mind. Not all of your staff live in Montgomery County. So we as the Montgomery County Health Department may not be privy if you have a staff member that lives in Saratoga County, Fulton County, Schenectady County. So if it is somebody that lives in our county, we will get that report. Once we receive a report, we are going to work with you guys on identifying what we call close contacts. Everything is going to be in writing that we can give you what that looks like. A close contact is a person who you've been within 6 feet of or less for greater than or equal to 10 minutes at a time. So if it's in a classroom, you might want to have that whole class be looked at, be quarantined. If it's in a classroom and a secretary who maybe passed that student in the hallway, or a janitor staff or anything like that, they wouldn't necessarily fit within that close contact profile. So we wouldn't necessarily need to quarantine an entire school or an entire wing. We really look closely at that definition. And once we work with the school nurse, administrator, whoever is going to be your point of contact for us, we ask for what we call a contact list. We will call all of those individuals and let them know that they were close contact and they need to quarantine for 14 days to self-monitor and to look for any signs or symptoms of COVID. And again, we also ask that they contact their physician as well to look into getting tested if the situation calls for it. And whenever anybody does test positive, the positive person isolates for 10 days. So it's isolation, quarantine are a little bit different. And sometimes that word gets used for the same situation interchangeably, thanks. And so isolation is for someone who actually is lab confirmed positive for COVID. Quarantine is for somebody who has been exposed potentially and is being monitored. So we will work closely with your staff, with your nursing staff, in identifying these people if there is a positive report. Anything, Sarah, you can think of?
No, I'll just show you the paperwork quickly. I'll hold this up. So anytime we issue a quarantine or an isolation for somebody who is in isolation or quarantine, the paperwork that you would receive in the mail looks like this. It is a 3-page legal document issued by Montgomery County Court with myself. So it will have the person's name, and then on page 2, it will give the specific address where the person must quarantine or isolate. And then the following page will give you the dates that you are quarantined or isolated with my signature. And then it will also give you a release date. If you test positive in Montgomery County, the first thing you will do after you get a phone call from us telling us you are positive is you will receive an email letter if you want it emailed, or you will get a letter in the mail clearly stating because you have tested positive for COVID, you must remain on mandatory quarantine at your home. And then these are emailed to positive people. If you are a traveler in Montgomery County, if you decided to travel and it was to one of the hot spots, we also have a travel letter because we are given flight lists and cruise lists and sometimes Amtrak lists. So there is a letter from us with the governor's executive order on travel. And then finally, your release letter. Your release letter will have your name, address, the date, your name, and then it'll say, as of the release date, you have reached your completion of quarantine or isolation, and you can return to normal everyday activities. So those are some of the legal papers that are given to folks who are either positive or on mandatory isolation and or quarantine. And these, we tell people, hang on to them. Your employer does need them. So folks will often call us and say, I need you to send that to Rich. And I say, no, I can't. That's a HIPAA violation. So we send all of the paperwork that you will need for your job to you, and then it becomes your responsibility to get it to your employer. For students, it's the same thing. We release the information to the child, to the child's parents. Even if the student is 18, we ask them, do you want us to send this to your mom, dad, parent, guardian, or do you want it yourself? Most 18-year-old kids want it sent to their parent. So all of the paperwork that a person needs to prove that they have COVID and the documentation is sent with that isolation and quarantine.
So this is a building question that goes along with the COVID testing questions. Is there a written plan posted about the testing and contact tracing and how it will work?
I just told you.
I know.
I just told you exactly how it will work. If we get a positive case in Montgomery County, guys, this is no different. We have been doing contact tracing since cholera in 1904. It's you get a positive case, you make a list of the contacts, you call all those people. That's the plan. That's how it's done across the state, across the nation, across the world. And it's been happening the same way since 1904.
It is on our webpage, and it has its at the top in the yellow banner. It says testing and tracing.
Correct.
Yeah, it has it
Just
written.
click on it, it's going to bring it to it.
Thank you.
Sorry, they've been asking this like.
It's the same. And it doesn't matter if we're tracing for COVID,
Right, the disease
or we're
doesn't matter.
tracing for hepatitis, or we're tracing for pertussis, or whatever it is. Tracing is the same no matter what the illness and disease is.
It's just, I think important, like we said, you're managed by whatever county you put your head in on, your pillow at night.
Yeah.
So you may not hear from Sarah and I if you live in a different county.
Guys, it is on the website.
In the yellow banner
It
at
is
the top.
written on the website.
Prominently displayed at the top.
Testing and tracing plan.
As the government required, it's prominently displayed at the top, one of the three things, right?
Sarah, I only have one question on the
Sure.
YouTube channel. What if a child has a family member that has tested positive for COVID?
If a family member has tested positive for COVID, that child is considered a close contact. So he or she would be isolated or quarantined as well. Some families, we've had this. So here's the other thing. I want you to remember, since March 14th, we have been testing, tracing, and isolating kids and families from Amsterdam straight through to St. Johnsville. You just don't know it.
Right.
So in that case, we have had families who live in Amsterdam School District, a parent or a child has tested positive. The family is then quarantined and or isolated depending on if they're positive or not. Once those individuals start to display a symptom, we arrange, or in the past, we have arranged for them to get tested themselves so that they know their status. So if we have a child that is a close contact of a positive and they live in this county, we take that over and we manage that case no differently. We would isolate or quarantine the child depending on if they get tested and test positive or if they're not going to get tested, because testing is not mandatory, it's voluntary. So
Right.
a parent can say, you are not sticking that thing up my kid's nose. And then at that point, we say, great, we will just issue the quarantine and we will go forward. If the kid gets symptomatic, if they get a fever, a chill, a cough, that often changes parents' decision to get them tested. And then we would proceed from there with that isolation or quarantine period.
After the quarantine or isolation, do you get retested at that point?
No. So there are some entities that say, in order for you to step back in my facility, you have to have a negative test. But here's the reality. That's not gonna prove anything, right? So if somebody has tested positive, you already know that they're positive. So scientifically, to continue to test them until they come back negative does not make scientific clinical sense for that person, because they can still carry the virus and be asymptomatic and not shed it. So that 14 days is that 14 days.
And so they're
Oh, that's
finding-
good. That's a good explanation of it. Okay.
So what they find is with the COVID testing, the swab, not the blood test, that people are testing positive while weeks after they've had their first positive, but it's dead virus that the swab is detecting. It is not live. It is not transmittable. The CDC and New York State Department of Health, from when you get tested, you have a first positive, your first time you test positive, 10 days, and you are no longer transmittable. That's the data. That's the science.
Wow.
We've found people have tested weeks and weeks consecutive. That's why the state does not recommend retesting. Once you test positive, you complete your 10 days, you're off isolation, and we don't recommend it because the swab test cannot differentiate live virus from unlive
Oh, wow.
DNA, or RNA rather, of the
Right.
virus.
That's a good. Okay.
Sarah, you spoke to the fact that
Great
there's
description.
25% that we're not going to be able to protect, so to speak. I'm not sure if teachers are taking that as meaning just in school, that we can only make sure 75% are good. That's
in life. That's in life.
That's
I mean, we can look at sexually transmitted diseases, right? Condoms are not always effective, right? I mean, that's reality. I hate to sound crass, but this is public health, right? There are nothing in this life is guaranteed 100%. So if we can keep ourselves in this facility 75% of the time, that's great. You also have to remember, as an educator and as parents, you are going to be going out into the community. Are you always, as an educator, going to be making good decisions for yourself? We have people in nursing homes right now who are COVID positive because the staff of that nursing home made poor choices to go to parties and family reunions and hang out with sick people and then come back into that facility and get those nursing home residents sick. So if you're worried about your health as a teacher, it's not just about protecting yourself in school, it's thinking about the choices you're making out of school. I have a school district right now that I'm working with where a bunch of the teachers decided to go on a Mexican cruise. Was that a good choice? Probably not. But they're all in Mexico on a cruise.
Wow. Wow.
I know. I thought they didn't.
Yeah.
Shut down.
They just started up again. Yeah,
Out at
that's
sea for weeks.
well said. Okay. Thank you. Excellent. So I want to get, we'll get back to questions. Thank you, ladies. Did a great job of explaining that. Just the tentative schedule that we had sent out, just so you can take a look at it. Thursday, Friday, virtual instruction starts. So we still have the 180 days that we have to commit to, unless we have a waiver on that, which we have yet to get. 14 through 18 is remote learning for all students. Chris, this is wrong for special education.
So I
Just read it.
anticipate for our special class kiddos that, that Thursday and Friday,
Yeah.
17th, 18th, they'll be in person.
They'll be in person Thursday, Friday. Special education will be in person that day, but the rest of the students will just have pre-K, kindergarten, and 6 through 9. We thought orientation was important to have for those new students, so that'll go on. Pre-K and kindergarten will be just simply parents or guardians bringing kids in, 15, 20-minute blocks. Not at this, they'll be in and out. No parent will be in it at the same time as another parent. So to keep that distancing and clean things off in between. But we think over that week, that'll be enough to get all pre-K and kindergarten parents in. And then 6 through 9 will have a full day orientation. And then that week of September 21st is that first full week of in-person classes for the purple and gold groups. So first week is orientation. As we said, parents will be notified of that scheduled date coming up in the next week or so. Lunches will be 3 options. It'll be prepackaged. It'll be a deli sandwich, a peanut butter and jelly sandwich, or a salad. Elementary is eating in the classrooms. 6 through 12 is eating in the cafeteria. Hallway traffic's gonna be one way. We spent a lot of money on signage, so kids will know where to go, how to keep distance. I shared this too, and I'm going to share it at the board meeting tomorrow too, is our costs are substantial. And I think the public needs to know it too, because we've heard some, concerns of still paying everybody full salaries and talking about tax dollars. So the district, as of right now, has accumulated about $460,000 in costs associated with COVID. But that's not including about $700,000 or $800,000 we have in technology that we've needed to order to replace lost or damaged Chromebooks. So we're over $1 million already for that, and there's been no federal or state stimulus for this. So I know that Rich Peters had a meeting with some representatives. I'm doing the same and have called out to just, let our local politicians know that we're doing everything on our part. What we want is, I started off with that slide of the spirit of collaboration. We want support from local politicians, the state and the federal government in regards to what we're doing. We want support from community members and businesses to work with our parents so they can get to work and maybe alternate schedules there, because everything's put on the school at this point financially too. So we're doing all we can to get that word out, but it's been substantial. There's been a lot of costs associated with it. We'll continue to work through it and, find a way to fund all of this. But for now, it's just knowing that we have to get all this equipment and testing and, thermostat or thermometers to scan and all that. So this is important. Code of conduct will be enforced. I have an addendum to the code of conduct to go towards the board tomorrow, just to talk about, instances will be reviewed on a case-by-case basis, but students are expected to wear their masks throughout the day. There's been questions, if a student were to have an altercation, what happens? That's for the adult to decide who's in that area. It's your decision to allow them to continue to fight with one another or to intervene, and we can't force you to do either. But my suggestion would be to go with your instinct, and hopefully end what was happening and get assistance. But if kids aren't following the code of conduct, they'll be held accountable. What we want to be cautious of is having students accumulating in the office because they refuse to wear a mask. So now we have 30 kids in a small room not wearing masks. That's a concern. So, we need to talk about what that looks like if a student isn't wearing it. They're going to be required to wear it into the building, but they could take it off in between. We know kids aren't going to always follow the rules. So we want your feedback on how we can do that, not just concerns of what will happen, but maybe your ideas on how we can address that and what would help you with that. So
there's some concern. I mean, first of all, the questions are coming fast and furious, and it's hard to keep up with them. Some of them are just general comments, and some are questions. And if we've come across as that we're not, what's the word I'm looking for?
We're concerned about everybody's health and safety. We care about our staff. We want our staff to be safe. Should be no feeling that we don't care.
Because
how would that come across?
People are saying that we don't seem to be taking their questions seriously, and that's not true at all. I did have a principal ask if there's a way we can print off all the comments so that they, as principals, can take a look and see if they can answer some building specific questions. But there's lots and lots that it's just hard to.
I would just say that concerns me because I started off the program saying that it's been a spirit of collaboration with the ATA. You gave us a list of questions that we answered, and we've continued to receive your feedback. We've adjusted the schedule. We've adjusted the times that kids are in the building based on your feedback. We've ordered thousands of masks, tens of thousands of dollars of PPE equipment that's specifically for staff. We've listened to concerns and adjusted as need be, and I specifically stated that please continue to give us your feedback so we can make decisions based on your concerns and adjust where needed. So I'm surprised to hear that you feel we're not taking your questions seriously. We'll continue to work on it, but it does surprise me. So continue to ask the questions. If we can't get to all of them today, we'll answer them another time.
And on your website, right, you have it's all written out on the Montgomery County Department of Health website, all the stuff that you just shared, right?
We can put this on this.
Okay, because they're asking for, because some people are auditory learners, or not auditory learners, and they need to have it visual. So they're asking if they could have that.
We will make sure that we get the information to you electronically.
Thank you. Thank you.
So other components of this, parents are asked to take their child's temperature. We're not relying on that solely. So we'll be doing the daily health screenings at the door. Students and staff are required to wear masks when they come in. And we'll have seating arranged for each classroom to have 6 feet apart with desks in the cafeterias where lunch is eaten too. Some lunch times, we're spreading lunch out over a 5-period time for pre-K through 5th grade to allow for that distancing and to allow Bob Barden and his staff to get lunches out. It's a much different process. So this is taking into account everyone's safety and health to ensure that there's time to clean up, time to get desks disinfected, and for those meals to go out. And then high school has 4 lunch periods. They are going to be eating lunch in the cafeteria, as I believe middle school is as well. I think they said they're eating in the cafeteria as well, and they said they should have about 100 kids in the cafeteria at a time. We talked about this, students with underlying health conditions to contact CSE office. If you have, this was for parents mainly, but if you have other people, please let them know to contact the building principal or the CSE office if they know students have some issues that need to be addressed. Extracurricular, interscholastic sports are on hold until September 21st. If they actually happen, we don't know. Please let parents know if you're asked about it. If students choose remote only, if sports do happen, they can participate in sports. They are allowed to, even if they're doing remote only, as long as they're participating and getting online each day and doing their classes. So please let that be known. And extracurriculars, we don't know what those will look like because not all of them can be done virtually. Talked about orientation. Working on schedules, as we said, September 3rd is when we plan to have schedules go out for the high school and I believe middle school as well. Working on dates for Chromebook distribution and pickup times. And we'll get more details on summer meal distribution as well of what that will, not summer meal, but in the fall, what that'll look like as well. And I think that's it. So we can just answer more of the questions if we have them.
I'm just cut and pasted it into a document. I'm trying.
Okay. What we can do as well is what we've done with some of the parent forums that had a lot of questions is we follow back up and put it, we can do a staff frequently ask questions and respond to those. I think a lot of them will be safety and health that we can follow back up with Sarah or Jessica. And then on our own, what we're doing.
Like the building matters,
Yes.
like classrooms, like how can you distance my class too small, things like that have to be worked out in the building principles.
Yeah.
And I'm sure during the orientation process, that's going to be
They're going to talk about that.
Right?
Yeah, there's some classrooms like at Techler and other classrooms that have bathrooms that we're not going to use, or those classrooms have bathrooms inside of them. So we're not going to use that classroom. We'll use it as a bathroom only for students. So you'll see that building level principals will have different breakdowns of what they'll use in their building specifically. So you'll get that information for your respective building. In addition, we had the architects go through and actually looked at every building footprint, every classroom, and they determined the maximum number of students we can have based on the square footage of the classroom. So we have that we can quantify, showing you what can be used. So that's already been done too. And again, that's another one of those costs we've taken on. We thought it was important to make sure we had that and had the architects actually look at it instead of me going in and saying, seems like 9 could fit. So that's not what it was. It's actually done and researched so they can tell us. So, all right.
The other thing, just that I forgot to mention earlier, so in New York State regulations, any illness or disease or virus in Montgomery County, if we have any more than 5 at a time, we're considered at an outbreak. So I don't know how years and years and years ago the state came up with 5 for our county, but if we had 5 cases of Legionnaires, if we have 5 cases of COVID, if we have 5 cases of tuberculosis, whatever the illness is, for us, our threshold for some, again, unknown reason is 5.
Does that matter in population if it goes up or down?
You know what? I have no idea.
Right?
I think they spun a wheel somewhere and it landed on 5 and they assigned it to us. So when we're looking at an outbreak, if we were to ever have 5 cases of COVID in this building, for example, we would already be at the threshold for an outbreak. So the county would be coming in and doing an assessment as to whether or not the facility could continue to operate. So that's why when we have anything, so if we're looking at something different, if we had a strep throat, for example, we would call your school nurses like we do every Friday. And if your school nurse said we have 5 kids out with strep throat this week, we would consider that an outbreak. It's not necessarily that we have to shut the elementary school down because of a strep throat, but then we would be tagged as a county with an outbreak of strep throat. And then we would be, it is a small number. It's a very small number.
Right.
But at some point in public health world, it made sense to the powers that be. So with something like COVID, the governor has said that any county that has higher than 9% of a population. So when we look at all of the students across Montgomery County, our number for COVID cases across the county in a school is 720. So we would have to have 720 cases of COVID in order for the governor to shut down all county schools. So if you take just your population, let's say you have, and I'll use small numbers. So if you have 100 kids in a building and you end up with 9 positive cases, the governor is going to come in and assess whether or not your building can continue to operate. Obviously, you have much more than that in a building. But again, it's one of those erroneous numbers. And I have said from the beginning, if I have 720 positive people in my county at one time, I have a much bigger problem than just COVID, right?
Right.
So the fact that, right now, year to date, from March 15th to August 18th, we only have 177. So I want to tell you how seriously we take this at the county. We decided back in March to shut your schools down, right? I was at a meeting with Rich, and at the time, Ray, at that point, our county executive said, we have one, we're shutting schools down, end of story. So we take this very seriously as to whether or not we allow things at a county level to open. And if we start to see an influx in this school, like we did back in March, and fortunately it was not, related to Amsterdam School at that point, we will come in and make that decision that this facility, this building, this agency, this organization, this business cannot operate.
Right.
We have that authority per public health law.
Good. Okay. All right. So a lot of the questions are coming out with that. And so it's out of our hands as a district.
Correct.
It's not our decision to make. And we've said that from the beginning. So thank you for that.
You're welcome.
Reiterating that. And some questions have come up too. So if a teacher in a 4th grade class finds that a student in that class tests positive, what happens to the entire class?
We will
You do contact tracing and call
we
them?
will do contact tracing, and we will notify the students in that classroom's parents. But what we have found happens, and in the world of social media, so if I call Rich and say, Rich, you tested positive for COVID, Rich is going to go on Facebook and be like, dude, I tested positive for COVID, man. Woohoo! 14 days out of school, right? That's what's happening with our kids.
Right.
So typically the whole world knows before we've had the capacity to call Rich's friends, parents, and let them know that he tested positive, that they were connected to somebody who was positive for COVID.
Right.
So when we do that education with people, we ask that, this is your protected health information. If you choose to go on
To let it be
Facebook
known,
or
right?
Snapchat and tell the whole world that you have COVID, we've seen 2 things happen. People call Rich and say, oh my God, buddy, I'm so sorry. How are you? Do you need anything? And then we've had other people bash Rich and say, I saw you at Walmart. I saw you here. I can't believe you. How dare you? You're putting everybody at danger. So we just tell people, this is your protected health information for a reason. And so keeping that personal and to yourself and within your family is really important. And then when we call the families, they always want to know, was it Rich Roberti? I know it was that Rich Roberti, right? And we say, that's protected.
Right.
I can't tell you that.
Right.
I just can tell you that on August 18th, you were in a room with somebody who was positive for COVID.
Thank you.
And
And you quarantine that whole room then? Do they have to stay?
We most likely
Most
would.
likely they would
in
quarantine
a school situation, we might most likely would, because we're always at Montgomery County going to err on the side of caution. I'm not going to knowingly put somebody in that room with somebody who's COVID positive. That would be poor medical practice.
Right.
And I think something else that's very important to point out to staff and families of your students, that if they do not get a call from public health, their child or they themselves have not been identified as a close contact. When anytime anything happens at an organization or a business, we get influx with calls. We've heard there's a positive, and we all know with social media, with everything, the rumor mills start, right? So we always try to reassure parents, they'll call and be like, nobody called me from public health.
So then you're okay.
Then that means you were not identified as a close contact. You will be notified. And generally, from the time we get a positive, 24 hours. I mean,
Sometimes less.
But if it's a huge number, and a lot of times we have to transfer things, or we have bad phone numbers, or usually less than that. But we make it a point. We will call multiple times within that 24 hours to let families or parents or whoever know they've been a close contact.
And in a school, you guys are in a great situation because you have your class roster.
Yes,
So if I
easy.
call you, Rich, and say, Nancy's 3rd period class had somebody positive, boom, I've got that information within 30 seconds, fax to me, email to me, with all of the information I need, and we hit the ground and we just go.
Right,
I mean,
right.
we've had instances in the past where we've had to call 15, 20, 30 people, up to 300 families, right? And we can get that done in a day and a half, standing on our head. I mean, this is what we do. And
Right.
we will work till 8:30, 9 o'clock at night, 6 o'clock in the morning, Saturdays, Sundays, to get this done because we have to. It's important. And so you in
Thank
a
you.
school
Yeah.
setting are the best because it's literally a captive audience
Right, it
during
is,
the
yeah,
day.
yeah. Yeah, because you've seen ads on the news saying if you were at Walmart between 3 and 8,
Right,
those will,
yeah.
you know, just capturing everybody. So we have a list, so.
Absolutely, and
That's
that's a
excellent.
nightmare. A school, you guys are here, I have your information, and we're rocking and rolling.
Right.
There's no delay. It's
We've-
going.
We appreciate that. That's tremendous support from our Department of Health, so thank you.
Will you share your PowerPoint with the staff? They're asking.
Sure, I can put that in. Yeah. Not a problem. We'll post it to the website. Not a problem. Questions? Do we have any recurring questions? If not, we can
The
answer.
majority of the questions being asked now, and I agree with John, it's building level.
Yeah.
So they're asking, when will there be a building-specific session to answer all of these questions?
They're planning that. Yeah, so our principals are online for this meeting. I was going to have them join in, but what we wanted to do was have an end to the remote learning option, to get all those numbers in, to have our plan submitted. So I would say they'll probably start having those meetings in the next week or two for those building level specific. So we've been doing the district level, bigger, broader spectrum, and they'll have those in the next couple of weeks.
Who does? Oh, I'm sorry. Sorry, Bev.
She wrote, and I thought that's a good question. She wrote, if a student was in 9 different classrooms and tested positive for COVID-19, does that mean all 9 teachers are quarantined for 14 days?
Well, we would go to that definition of close contact. If you're a teacher and that student happens, you know, again, we have to go by what the state says protocol and what the guidelines. Otherwise, you know, I don't know how if your students are moving or your teachers are moving or
Yeah, that's something
how you,
our students are moving as of now. Initially,
Are
we
they
talked
still
about the adults moving
Yeah.
and the students staying, but it was scheduling very difficult because who's in the classroom with the kids when the teacher moves?
Yeah.
It became more about staffing than anything else.
Sure.
It's impossible to have somebody wait until the teacher gets there.
yeah, I mean,
So,
yeah, if that
right,
teacher
so-
was within 6 feet for greater than or equal to 10 minutes of that student, they would be considered a close contact, and we look very
So
closely
all
at them
9 teachers would have to be quarantined.
if they fit that
If
definition.
they get
Yeah.
it. So if the kid is sitting in the back of the room and the teacher is up at the front of the room, that's way more than 6 feet, right? But if that teacher goes over and they're talking to that student, or they're sitting with that student, or they're a one-on-one aide, or they're doing after-school, tutoring or whatever, then, we have to look at that and we have to say, okay, so that you were with that student for a half an hour, sitting next to him, her, that's a close contact.
Yeah.
So it's almost like you gotta, make sure teachers are remaining at 6, try to remain as much as they can.
Maintain that 6 feet whenever possible, yeah.
Absolutely.
And
Yeah.
hand hygiene and masks and all those good things. And I'd like to reassure people, we hear a lot in media and a lot, secondhand stories and so on. Sarah and I have been, since 5:30 in the morning on March 15th, when we got our very first case, have looked at every situation with a microscope, and we've looked at analyzed contacts, symptoms. And there are cases where a family member is positive, they eat dinner with, they're very close, and everybody else in that family is tested negative, and they haven't worn masks. And so there's lots of situations where we have found, evidence that, if you do the right things and you're washing your hands before you eat dinner, and, you're doing all these great things that have been recommended, you really can minimize that risk. That risk can be minimized. So I just like to
good.
reassure people, and I don't know if the story with the hairdressers, there was a study, symptomatic hairdressers had seen 167 clients, and 70 of those tested negative, and they were with them in close contact, and two stylists. So, but then there's also nursing homes where we see it spreads very rapidly. So,
Right.
every situation is really looked at. We have standards and guidelines, but we really take every case and look at it very closely. One case is not the same as another. So it's important to have guidelines, but we really use the tools that we have, and we take it very personal, Sarah and I, and in our county. We've taken a lot of pride in all the work everybody in our communities have done. And we will continue to work with everybody and doing what's best for
We thank you for
everybody.
that. Okay. All right, well, I want to thank everyone, Sarah, Jessica, especially for being here with us today. It puts me at ease knowing that we have these two individuals working so hard on our behalf. They're certainly an asset to our areas. They work tremendously hard and give us a lot of feedback on what we can do, and we know that they'll take over if something were to occur and run with it. All the other questions, I think, are more building level, so we'll let those happen. Those building principals will have their meetings.
If they have multiple times a teacher that has to be sent, be quarantined, will they have to use their own sick time?
If they're waiting if they're seeking a diagnosis, they don't. We'll get that language out.
Yeah.
We have,
That's been asked.
that question's been asked, so
And that's my last
if
one.
you're seeking a diagnosis, you do not have to take your time for sick time until you receive that diagnosis, and then it's determined. So we've talked to our school attorneys about that. I'm sure NICET has some information on it, but we can get that information out as well in an email that will explain that process, so.
And we will provide you the proof. If you're a Montgomery County resident, we will provide you with the proof of your quarantine, your test results, your
To show.
isolation, and your release date to give to your employer.
There you go.
I can't speak for other counties,
But
so
for
if you live in
Montgomery
another county,
right,
I
if
don't
you're
know.
here.
Yeah.
Okay, good question. So please continue to send the questions. We've listened to your feedback. We will continue to listen to your feedback and adjust as necessary to get everybody to a comfortable level. They're assured that they can come back to work safely. So thank you for your time. Have a great afternoon.
I did cut and paste it off so that they can, you guys can